If they're comfortable taking their shirt off, and you know that's what you would do, but really we're gonna drape him, and I didn't do that. So Don Deemer, I'm a PA student. I'm gonna be doing your lungs and thorax exam today.
All right.
All right. Okay, so first thing I'm gonna do is I'm gonna check your pulse here. Then you do this for the required time and count the respirations. They're easy to see. Respirations are 14 and unlabored, and I'm going to inspect the posterior thorax and the anterior thorax. I'm inspecting for symmetry, anatomy of expansion, lesions, skin lesions, central cyanosis, and there appears to be none. His lateral diameter is greater than AP diameter. All right, so now we're going to move on to palpation. So I'm going to palpate the posterior thorax for any masses or tenderness. Can you please tell me if any of this hurts? Nothing? Okay. So there's no tenderness to palpation and there was no masses palpated. Now we're going to check for chest expansion. So you're going to go down here around the 12th rib and then push in until the skin kind of comes together like that. Okay, can you take a deep breath in? Okay, chest expands symmetrically, bilaterally. And if you were going to name one thing that would cause, you know, chest not to expand bilaterally, you could name one of those things I said. You just, you know, memorize that. I don't want to go through the whole thing naming stuff, but that's what you guys need to do. All right. So next thing we're going to do is we're going to palpate for tactile phragmitis. All right. So each time I move my hands on your back, would you say 99?
Yep.
All right. Thank you.
99. 99. 99. 99.
Okay. Tactile phragmitis is equal bilaterally. There's no increase or decrease in the transmission on either side. Next, we're going to percuss the lung fields. All right. So I'm going to be tapping on your back a little bit. Okay. So. Okay, so all the lung fields are resonant and they're equal bilaterally to percussion. Now we're going to percuss for diaphragmatic excursion. So when I tell you to, take a breath all the way in and hold it, and then when I tell you to let it out, let it all the way out and leave it out, okay?
Okay.
All right. So, okay, take a deep breath in. Okay, let it out. Hold it there. Okay. You can breathe normally. Now you take your little tape measure out after you mark those two areas, measure that, and then go around to the other side and do the same thing, okay? Then diaphragmatic excursion is equal bilaterally and approximately 5 to 6 centimeters, all right? So, the next thing we'll do now is we'll go ahead and auscultate the lung fields. Each time I move my stethoscope on your back, please take a breath in through your mouth a little bit bigger than normal, okay?
Okay.
All right. Okay, there were no adventitious breath sounds heard. Breath sounds were symmetric. And so now you're going to come around and take care of the anterior thorax, except for the inspecting. We already did that. So first thing I'm going to do is I'm going to be feeling your chest and seeing if there's any tenderness there. You let me know if it hurts, okay?
You want me to spin around?
Yeah.
Yeah, spin around. Be better. All right. So now that we're in better view of the camera. Any tenderness there? Okay. We're going to check for chest expansion. All right, take a deep breath in. Okay, chest expands equally bilaterally. Now we're gonna palpate for tactile fremitus. So each time I move my hand, do the 99 thing again, okay?